Loss of being able to hear can be a scary thing for some people, and doctors are urging people to not ignore the warning signs. This morning on our Ask a Specialist, we'll talk about what you need to know, and that is with Dr. Ken Pugh, audiologist at the Queens Medical Center, West Oahu. Good morning, Dr. Pugh. Thank you for joining us.
Hey, good morning.
Yes, it's our pleasure to have you. So tell me, first off, what is sudden hearing loss?
Good question. Very good question. Well, that refers to a condition as an abrupt loss of hearing that occurs instantly or within a 24 to 72-hour window. During this time, all sounds usually become muffled or faint. Key to sudden hearing loss is a majority of the cases involve one ear. Sudden hearing loss in both ears is common, but the likelihood is extremely rare, probably no more than 3% of all cases. In addition to sudden right ear and left ear hearing loss, they occur at the same rate. So one ear is not at a greater or lesser risk than the other. However, the effects may differ because your ears are partial to different sounds. The right ear responds more quickly to conversational speech, while the left ear is more tuned into intuition or emotion responses. Also, gender is not a risk factor either, as the ratio of occurrence in sudden hearing loss between females and males is similar.
That's some very good information. So also, what are some of the root causes of sudden hearing loss?
Okay. Probably the most common cause of sudden hearing loss is a viral infection. Shingles serves as an example of a virus, but measles, chickenpox, and mumps are other types of viruses that could possibly cause the condition as well. Another cause is inflammation, and that's described according to elevated temperature, increased redness, swelling, or loss of function because the inflammation restricts nerve impulses or restricts blood flow. Next, certain medications can cause damage to ear structures, resulting in hearing loss, ringing in the ears, or both. These medications are considered ototoxic. There are more than 200 known prescribed or over-the-counter medications on the market today and are problematic, especially if taken in high doses.
Very interesting. Now, lastly, how is sudden hearing loss treated nowadays?
Okay. Without a doubt, sudden hearing loss should be treated as a medical emergency. When a loss occurs very quickly and typically in one ear, going directly to the emergency room is recommended. In doing so, a steroid regimen, typically either through some oral prescription or an injection, is the common course of action in the hope of returning the hearing to pre-existing levels. Along with that, follow-up testing with an audiologist as well as consultation with an ear, nose, and throat physician are advised.
Thank you very much for that information, Dr. Pugh. Very helpful. And then to learn more about sudden hearing loss, you can sign up for the Queen's Free Speaking of Health virtual lecture. It's scheduled for this Thursday, May 19th. That'll be from noon to 1 p.m. And you could sign up, and you could also call 691-7117 or visit their website, www.queens.org/events. And yes, once again, I just want to say thank you to Dr. Pugh, audiologist. Thank you so much for bringing more awareness to this issue. Hearing loss is definitely not a fun thing, but there are ways to help repair it. Thank you so much, Dr. Pugh.
Again, thanks for having us. Thank you.
Yeah, it's our pleasure.